All right, so we'll be performing the CAM evaluations for the gluteus medius muscle. The first CAM we will do is the internal rotation of the hip. I will have the patient laying supine on the table, and I will ask the patient to actively internally rotate at the hip as far as they can go. The second CAM evaluation I'll be doing is 30 degrees of abduction. So abduct the leg 30 degrees out and ask the patient to internally rotate. The third CAM evaluation that I'll be doing is 30 degrees of hip flexion, 30 degrees of abduction and internal rotation. So I'll actively have the patient flex their hip up to 30 degrees, abduct to 30 degrees, and have them internally rotate at the hip as far as they can go. The fourth CAM we'll be doing is straight leg 30 degrees of hip flexion and internal rotation. So just bringing the patient into 30 degrees of flexion, of hip flexion, and asking them to internally rotate as far as they can. I will be performing all of these exams on both sides. The third one we'll do is 30 degrees of hip flexion, 30 degrees of adduction, and internal rotation. So we will bring the patient to 30 degrees of hip flexion, 30 degrees of adduction, and ask the patient to internally rotate as far as she can go. Next, we'll be doing straight leg external rotation of the hip. The patient will be laying supine, and I'll ask them to actively externally rotate their hip as far as they can go. Next, we will be doing a 30 degrees of hip abduction and external rotation. So I'll actively have the patient abduct their leg to 30 degrees and externally rotate as far as they can, keeping the knee and the leg straight. Next, we'll be doing 30 degrees of hip flexion, 30 degrees of abduction, and then active external rotation. The next CAM we will be performing is 30 degrees of hip flexion and external rotation. So bringing the patient up to 30 degrees of hip flexion and asking them to actively externally rotate. Next, we will be doing 30 degrees of hip flexion, 30 degrees of adduction, and external rotation. So we'll actively have the patient flex their hip, 30 degrees of adduction, and then externally rotate as far as they can go. That concludes the CAM evaluation for the gluteus medius muscle. The next thing we will be performing is the ACM&S testing for the anterior fibers of the gluteus medius muscle. So I will have the patient laying supine on the table. I will stand at the foot of the table. I'm going to have the patient actively abduct their leg to 30 degrees and fully internally rotate at the femur, at the hip. I'm going to stabilize the uninvolved leg, and I'm going to have the patient actively push out when I say go into my hand, ready, go, and relax. I will then perform the same test on the other side, actively abduct to 30 degrees, fully internally rotate the femur, and ask the patient to push out into my hand when I say go, ready, go, and relax. Then to move to the DFAMAT for the gluteus medius muscle, I will have the patient lay on her side, lay on this side for me. I'm going to palpate the crest of the ilium. I'm going to find the TFL and come just posterior to that. I'm going to make a cup around that insertion. I'm going to dig and just palpate along those fibers of the anterior portion of the gluteus medius. I will then go down. I will find the head of the femur. I will come up and palpate at the insertion of the anterior fibers of the gluteus medius. I will then have the patient return to the supine position. Face up for me. And the PIC that we will be performing are 6 contractions for 6 seconds. So I will actively have the patient abduct their leg to 30 degrees, fully internally rotate. I want you to push out 6 times for 6 seconds at 10%. So Think of 100%, push out at 100, push out at 100, half of that again, half of that again. Push, relax, push, relax. I will perform that 6 times. All right, next we'll be performing the ACM&S testing for the middle fibers of the gluteus medius muscle. The patient is laying supine on the table. I will have the patient actively abduct their leg into 30 degrees. We will bring their foot and ankle and hip into a neutral position. From here, I'll stabilize the uninvolved leg with my other hand, cup the involved leg's lateral malleolus, and I will have the patient push out into my hand when I say go. Ready, go. Push out. Good. Depending on what we're finding, we'll move to the DFAMAT for the middle fibers of the gluteus medius. I'll have the patient turn onto her side. Lay on this side for me, please. I will palpate the crest of the ilium, finding the notch. Palpate the TFL, find the anterior fibers, come just a little posterior to that, right at the origin on the crest of the ilium. I'll palpate. I will slide down then to the insertion on the femoral head, and I will palpate those fibers. After performing the DFAMAT, I will have the patient roll back into the supine position, and we will perform the PIC contractions, actively abducting the leg to 30 degrees. I'll have the femur and the leg in a neutral position. I want you to push out into my hand at 10% for 6 times for 6 seconds. Ready, go. Relax, push, relax. I'll perform that 6 times, of course on both legs if necessary. Finally, we will be performing the ACM&S testing for the posterior fibers of the gluteus medius muscle. To do this, I will have the patient laying supine on the table. I will have the patient actively abduct their leg to 30 degrees, go into full external rotation at the hip, keeping their knee nice and straight. I will stabilize the uninvolved leg, cup around the lateral malleolus and the front part of the shin, and I will have the patient push out into my hand when I say go. Ready, go, push out. Good. If there is weakness tested there, I will have the patient turn on their side. Down this side for me, please. I will palpate the iliac crest, specifically the posterior portion. I will go just inferior to that, to the posterior fibers of the glute med. I will palpate. And then I will slide down to the insertion on the greater trochanter, specifically the posterior portion, and I will palpate those insertional fibers. After performing the DFAMAT, I will have the patient roll back onto their back. Have them bring their leg out to 30 degrees of abduction, externally rotate from the femur, keeping their leg nice and straight. We will perform the PIC contractions from here, which will be 6 contractions for 6 seconds at 10% effort. Go ahead and push out into my hand, 10%. Relax, push out. Relax. We will perform those 6 times and on both legs if necessary. That concludes the CAM evaluation, the ACM&S testing, the DFAMAT, and the PIC for the gluteus medius muscles, all 3 portions, anterior, middle, and posterior fibers.